Hello guys, hello. Today is Friday and you know what time it is. It's Miss Dr. Lady's Tips for Your Teeth. You know we come to you live every Friday afternoon straight from Hapeville, Georgia. I am Dr. Joy Fremont. Phone number 404-761-1659. I am a dentist right here from the Atlanta area and still am in the Atlanta area. So we are here at Hapeville at Freemont Dental, and I'm going to give you your weekly tips for your teeth. Before I do that, I still want to send my prayers and my office staff's prayers out to the people of Houston and the surrounding areas that are still suffering in the aftermath of Hurricane Harvey. So if you have been watching us and following us, we have teamed up with Freemont Foundation, L&B Tax Service, New Beginnings Hair Studio, and New Praise Christian Center, all here in the Atlanta area, and we are doing a toiletries and a school supplies drive. So please check out the flyer on my page, go to their business pages, and do what you can. We are not accepting money. There's no money being collected, but we are accepting toiletries and school supplies starting now. The school supplies will be donated to the kids in Houston who have been affected from elementary to high school. And the toiletries are going to be donated to the students at Texas Southern University and Prairie View University. So please do what you can. Bring those by my office now. Our final date for collecting will be September the 16th. And on that day, we're going to all go to the Represent Yourself 5K in Grant Park in Atlanta, and we'll do our final huge collection at that point. I know what you're probably saying. The hurricane was last week. Are you going to wait till then? Okay, let me tell you something. If you remember Katrina, if you remember the flood last year in Baton Rouge, these people are still suffering. So I don't think it will ever be a time in the very near future that we cannot continue to give. Okay, so give what you can. If you want to bring it now, come on, bring it over now. We are accepting those donations now until September the 16th. We want you to come to the walk. I mean, you know, hey, come on out. But if you're not going to stay for the walk, drop it off. We will have people in the parking lots collecting those donations for the people of Houston. Okay, for more information, just follow our page. Like I said, it's Fremont Dental, Fremont Foundation, New Praise Christian Center, New Beginnings Hair Studio, and L&B Tax Services. We are collaborating to help the people of Houston. So please do what you can to donate those toiletries and the school supplies, okay? No amount is too little. No amount is too large. Please come by, check out our pages, and look at the flyer for more information on what you can give, okay? So as far as the 5K, y'all, it's September the 1st today. We only have a little over 2 weeks until the big day. We are celebrating our 20th anniversary. Yep, I've been in practice now for 20 wonderful and long years right here in the East Point and Hapeville area. So I'm very grateful for that, and we are going to celebrate on that day, okay? You get to meet my staff. You get to meet me. I mean, you know, hey, I know you want to come see me. You can come on out and see us. We're going to have a great time. We're going to walk, and then we're going to stay for the party afterwards. We're going to dance. We're going to have music. We're going to have food. And if you know anything about Fremont Dental, we give out some great stuff. So we have some good surprises for you. The Grand Marshals of the race will be Derek Bozeman, as well as Miss Juicy. Yep, Miss Juicy from Little Women of Atlanta will be out there live in living color. So come on out, party with us. We're going to have a great time, okay? Woo, for more information about that, you can go on and log into FremontFoundation.com. That is FremontFoundation.com. Go ahead and register today. You do not want to miss it. Don't wait until the day of and try to register. We're going to have a great time. I'm very excited about that. Thank you for joining the Fremont Dental team. You know, right now, we're tied for first place with the number of walkers and runners on that day. So I want to blow it out the water. So please join Fremont Dental on our team for the 5K September the 16th. Okay, got that out the way. I want to talk to you just a little bit about what is going on with you. Because a lot of times people don't understand that when they come see me as a dentist, I do communicate things that I find with your medical doctor. We have to collaborate. I've told you before that the mouth is just one part of the system in your body, okay? It's just one part. It's all connected. So please understand. And some people don't understand the fact that they can get treated for sleep apnea in my office. I get it. I understand those questions, but trust me, I can. All right? If you don't understand what sleep apnea is, definitely just a quick recap. Your throat or your airways are actually closing up and collapsing when you're sleeping, okay? They're shutting off and you're not breathing at night. You end up choking and gasping. And over time, it puts so much stress on your heart and other organs that it can lead to your demise. So yes, it can kill you, okay? So it's very, very, very serious, okay? So with that being said, a couple of quick stories. So this is really true. It happens in my office quite often, okay? So when you come to my office for treatment, anybody over the age of 18, we're going to give you this questionnaire. Either you're coming to my office for cleaning feelings, or even if you come to me as a sleep apnea patient, I'm going to give you the same exact questionnaire to fill out, okay? You list all your risk factors, you list any health issues that you have, any medications you're taking, all of that, and that will determine what we're going to do, okay? Some of y'all lie. Y'all lie, you lie, you lie, you lie. Tip number 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Do not ever lie to your medical or health care professional. It's just not worth it, okay? We have been specially trained to treat you, okay? So if you put on there that you're 105 pounds and you're clearly 205 pounds, come on now. If you put on there, you come to my office that you floss every day, but I can't even see your teeth because of, come on. You know I can tell, right? If you put on there that you have, you don't have high blood pressure, then you list on your medications, high blood pressure medication. Come on now. If you tell me you don't have any allergies, and then I go to write your prescription for amoxicillin, and you take it. Come on now. So first rule of thumb, do not ever lie to your health care professional, okay? It's just not worth it. It really isn't. I mean, we're not going to judge you for whatever you say. Okay, so you get this screener in my office. We give it to you. Once again, it's free. Yes, Tanya Poindexter. See, you know what I'm talking about. You get it, okay? So based on what you tell me on that questionnaire will determine what I'm going to do next. And sometimes I send you home with a free overnight screener. So I said free and I said overnight. I said free and I said overnight. So it's no charge to you, okay? I send it home with you and you bring it back. And if that overnight screener says, hey, ding, 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 this person is at very high risk for having a sleep disorder breathing, the next thing to do is to recommend you have a sleep test. All right? No money at your pocket so far. I've screened you. I've said, hey, here are your risk factors. You told me you have high blood pressure. You told me you've had diabetes. You told me you wake up choking. You told me you can't sleep half the time. You told me that you're dizzy, you're drowsy all day. Okay, the screener shows that you may have a high risk of having sleep disorder breathing. Okay, so then I tell you, know what, ma'am? I'm going to send you home with a sleep study. Or I'm going to recommend you go to the sleep lab or whatever to have a sleep study. And then you tell me, you know what, yeah, let me talk to my doctor about that. Yeah, okay, so how long have you been going to your doctor? Oh, I've been going there about 5-6 years. Yeah, and they've never talked to you about this? No, but I'm going to bring it up to them. So your doctor who you've been seeing for 5, 6, 7, 8, 9, 10 years, 3 or 4 months, has never brought this up to you after you have all of these symptoms, after you're on all these medications for high blood pressure, you had a stroke, you have diabetes, and they've never brought up to you the fact that you may have a sleep disorder breathing that may be causing all these problems. But I've told you that, and you're not going to listen. You're going to go back to them that are underdiagnosing you, Yeah, that's what I see in my office sometimes. So I'm wondering, okay, you go right on ahead. Go talk to that doctor. Now, mind you, all I can do is tell you what I know. I really don't get offended. I get concerned, but I don't get offended. Okay, so when you leave my office, I send that same doctor who hadn't told you anything all these reports. They say, yeah, you know, you're right, Miss Ma'am, you should go ahead and take that test. Ding, 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 ding. What the devil? I don't care who tells you. If you have these risk factors, I'm going to tell you. It's up to you to do with that what you want to do. Either live and suffer, or the other option is not live. I'm just keeping it real with you, okay? So I trust that because you have come to my office and are seeing me for however long period of time, that you trust what I'm telling you. Trust me. I wish everybody that came to my office never ever had a problem. It'll be glory. But that's not the reality of it, okay? So then, you know, the next scenario is this. True story. I'm talking about my mom. No lie. Okay, so I've told you on previous videos that my mother has sleep apnea. And I've told you my mother is not a walking billboard for sleep apnea. I mean, she is nowhere near overweight. Walks all the time. Relatively good health. You know, she does have high blood pressure. And she snores. Can bring the house down with it. I'm just keeping it honest with you. Okay. So I said, you know what, Mom? I'm going to go ahead and give you a sleep study. All right? Sleep study comes back. She has sleep apnea. Wow. Okay, so like I said earlier, I give all these reports. I communicate very closely with all of my physicians, the ones that my patients go to. I call a doctor on the phone and say, hey, you know, she has sleep apnea. We're going to be doing this. What do you mean she has sleep apnea? I mean, this man gives me the blues, lets me have it. What do you mean she has sleep apnea? She never been tested for that. Well, yeah, she has been tested for it. You know, we gave her the sleep study. She has it. I said, wait a minute. I said, hold on. She's been coming to you for now, I know, for at least 15 years. She's on high blood pressure medication. She comes to you at least once, if not twice a year. Why haven't you tested her for sleep apnea? I'm just asking. And he said to me, well, I don't think she has it. She don't think she has it? No. I said, well, what does she have to do for you to think she has it? Well, at least tell me she snores. Really? So you really believe, I'm giving it to you straight up and honest, this is a medical boarded sleep, now he's a regular boarded physician, I'm not going to tell you his name, tells me that because he did not diagnose it, he didn't even screen for it. By looking at her, he said, I don't think she has it because she didn't tell me that she snores. She good. My mother has the most severe form of sleep apnea. Straight up. And she's getting treated for it now. Okay, so when I suggest to you something, trust and believe, it's not to put money in my pocket. It's to help save your life. If I could have saved my father's life 4 years ago by knowing what I know now, sleep apnea takes 12 years off your life if it's untreated. That's real talk. Real talk, okay? No one but the man upstairs, that's God, can tell you you do or you do not have sleep apnea unless you get tested for it. And I mean a overnight sleep study. Okay, I've been in the medical field since birth. My father, as you know, was a physician. He was the chief of staff at Atlanta Medical Center. Very well known in Atlanta. I grew up around doctors. So hear me clearly. I am the lover of all doctors. Okay, so I know it. I got it. Grew up in that home. I know this, okay? But do not let a doctor's superiority complex keep you from living. If you go to your doctor and you tell them what I said, or anyone says, or you have these questions, and they tell you by looking at you, by opening up your chart and reading it, that you don't have sleep apnea without giving you a test, I want you to, if you have a gown on, put your clothes back on and walk out the door and request your records. You cannot be diagnosed with sleep apnea without being tested. Point blank, period. If they tell you that, they might not know they're lying. They just may not be educated on it. So I can't call them a lie. I'm just going to say they don't know any better. And until you know better, you won't do better. Okay? So there are two types of tests you can take. You can have a home sleep study, or you can go to a hospital lab. And once again, I tell patients every day, I don't care which one you take, as long as you take it. There are doctors who are looking at this right now are going to be very mad at me. I want you to up your game. Up your game. Because there are patients around here who are dying because of your lack of knowledge. I'm sorry. I'm just saying the truth. There are 90% of people who are undiagnosed. 90% undiagnosed with sleep apnea. They have it and they don't even know it. Just get checked out. It's worth the small investment to have a sleep study. I wish it said no. I hope it says no. Okay? So somebody's at my door. I hope it says no and you come out great. Okay? So if you are a smoker, you have three times more chance of having sleep apnea. If you snore, 59% more chance of having sleep apnea. If you're obese, 30% more chance of having sleep apnea. Men have 2 times more chance of having sleep apnea. Women who are postmenopausal have a higher chance of having sleep apnea. Okay? If you're diabetic. Now, I'm not saying if you have these things, you have it. I'm just giving you the risk factors, okay? If you've ever had a stroke, 90% chance. 90% chance of having sleep apnea. Even kids can have it. If they have adenoids or tonsils, get them checked out. You know, kids aren't going to walk around sleepy all day. They're actually going to be extra hyper. There are kids now who have been diagnosed with ADD who don't have ADD. They just have sleep apnea, okay? Let's start and stop writing these kids off of having ADD and putting them on Ritalin. Get them a sleep study and get them off that medication, okay? Kids that are hyperactive have a high chance of having sleep apnea because they can't breathe at night. Okay, I'm being very honest with you. I'm being very honest with you. Get those adenoids out if it's time. Remove those tonsils if it's time. And see what happens. I'm just saying. Okay? If you're a heavy drinker, you take sleep medications. Like, okay, so your doctor is giving you all these sleep pills. They're giving you, what is it? What's the sleep medication? My mind just went blank. The sleep medication, the sleep pills. It's a prescription. Okay? They're giving it to you. You can't sleep. But they aren't even... There you go. Thank you, Tanya Poindexter. Ambien. How do you know about the Ambien, Tanya Poindexter? How do you know about Ambien? Thank you for saying that so quickly. You said Ambien very quickly. Yes, Ambien. Okay? If they're quick to give you a drug to sleep with that, okay, melatonin, that's natural. That's good too, Dara Taylor. If they give you prescriptions to sleep just off the rip and don't even ask you this question or test you, they're not helping you. Because guess what? When you take a sedative or tranquilizer, or you drink heavily before you go to sleep, your muscles in your throat relax. And you can't control what you're doing. Hell yeah, you're sleeping. But you may be killing yourself, okay? Do not just take it. Trust me, I know. Let me tell you. I'll take an Ambien in a minute. I really will. But I have sleep apnea, okay? And I use my appliance at night, so my airway is not going to close. All right? But please be careful if you have hypothyroidism. All right? And for women, if you have polycystic ovary syndrome, guess what? You're at 12% higher risk. So these little small things can add up, okay? So one, I did not say if you have these things, you have sleep apnea. And two, all I'm asking you to do is to talk to your doctor. If they tell you, oh, don't worry about it, demand a sleep study or go somewhere else. All right? Do not let your insurance company or your doctor or whatever dictate that. I'm telling you, take the study, let the study say no, and then take your sleep medication. All right? This is just to help you. No one can tell you by looking at you yes or no. You have to take a test, an overnight sleep study, to be diagnosed. Okay? I'm here to help you. If you have any questions about that, please drop me a comment below. I have been reading your comments. Those have been asking. I comment on them, reply to you. I've gotten tons of inbox messages. I love seeing the questions. That means you are concerned. If you are out of town and not in the Atlanta area, I got a few comments last week about that, and you need help, I will help you find somebody close to you to help you, okay? I'll do all I can to help you live better, all right? Those are today's tips. If you have any questions, drop them below. I'm here for a few minutes. Don't forget, we are collecting toiletries and school supplies for the students in Houston from now until September 16th. Please come to the 5K to drop them off or come to my office. And we are located at 606 South Central Avenue in Hateville. Okay, I have a question from Derek. Hey, Derek. Yes, I will be around later. Call me. I know you're in California. We've talked, so go ahead and give me a call. You have my number. Call me today. I'll be around. Just give me a buzz, okay? Once again, the school supplies drive and the toiletries drive, bring it to my office at 606 South Central Avenue in Hateville, Georgia, or save them and bring them to the walk. That's the 16th of September, man. Let me tell you, it's 2 weeks. Ask Daryl Taylor. We're going to have a good time out there. We are ready for you. Come on out there. We're going to have a great time. You can bring your school supplies and toiletries there. If you don't want to come to the race for whatever reason, I don't know, but you don't want to come to the race, just drop them off. We will have people in the parking lot collecting those for you. Or come to the office. We're going to be joining up with L&B Tech Services, New Beginnings Hair Studio, and New Praise Christian Center. All 4 of our locations are joining forces with the Freemont Foundation to collect these things for the people in Houston. It's never too much, too little, or too late to help, okay? Join the Freemont Dental team. Freemont Dental team at fremontfoundation.com, okay? The 16th, I'm trying to tell you, 20 years in business, so you know we're going to do it big out there. I'm not even going to tell you all that we're going to do, okay? You have to come. Don't miss it. I will tell you one thing. You're going to get the Freemont Dental team t-shirt. I'll tell you that much, all right? That's all I'm going to tell you, okay? So please, please, please call me. Contact me, email me, inbox me, send me a comment. If you're on Instagram, send me a DM. All right, thank you guys. Have a great weekend and take what I said to heart. Talk to you later. Bye.